Well, some Toronto area hospitals are now reporting a shortage of epidural tubes amid ongoing global supply issues. William Oser Health System now confirming they've developed an epidural catheter supply strategy to try to meet the current needs. But when asked for comment, Ontario's health ministry said while they are aware of these shortages, Ontario has an adequate supply of epidural catheters. For more on this, I'm joined live this hour by Dr. Constance Nasello, President of the Ontario Society of Obstetricians and Gynecologists. Thanks so much for making time, Doctor.
Oh, you're welcome.
So how bad is it right now, and what does the situation really mean for patient care?
Well, it is a situation that Ontario's OBGYNs are familiar with. And we have been preparing for possible shortages. Generally, we've used a strategy that was first published from Saskatchewan Health. And, these shortages we first heard about 2 or 3 weeks ago, and they're moving across Canada from the West Coast. So Ontario's hospitals actually have had some warning, but this is really a supply chain issue, and like many other medical supplies, it's related to the pandemic.
So that's your understanding of how we got here? It's supply chain issues?
Yes. And there are a couple of preferred epidural types of catheters. And, it's important to know that our anesthetists do tend to get more comfortable with different ones. Some are more flexible, a little easier to place. Some are more rigid. And those ones seem to be ones that are causing a bit of a problem, but they both are still available at present. The supplies seem to be managed pretty well at present. So the local Ontario health organizations are monitoring the supplies, and as part of the ongoing strategy, Ontario Health has mobilized a group of obstetricians and anesthetists to develop some strategies should we get much shorter.
Okay, so when you hear the province say that there is an adequate supply of epidural catheters, is this what you're talking about, that there are other options, but they may not be the preferable catheters?
That's one of the issues that we're running into. So generally, the epidural catheters come as a kit, but the individual components may still be available. And so that's what's currently being used, and the anesthetists are kind of assembling the parts as they are needed. And as best we can tell, the supplies are between 2 and 4 weeks. And it's not, I think it's more related to just-in-time delivery, and that's something that's developed over the last 20 years. And that's a different kind of supply chain issue, of course.
I want to ask, Doctor, about who may be impacted by this most. It appears that pregnant people, more than half of them opt for an epidural when in labor. At this point in time, will everyone who wants one while in labor get one?
At the moment, it seems that we have adequate supplies. But, I think that anyone that is preparing to deliver should also look at other non-medication options for helping to manage pain. And it's important to use both strategies, both non-medication and medication-related. And I worked for 12 years in a facility without epidurals, and we did about 800 deliveries a year. And, most of the time we were adequately able to manage pain for our patients. And it's just it's just needing to reestablish some of those protocols. And we're working both locally and with Ontario Health to help do that.
Okay, and you mentioned we should see a boost in supply in the next couple of weeks, so fingers crossed that is the case. Dr. Constance Nasello, thanks so much for your time. We appreciate it.
Thank you, Chanel.